Hello, how are you? My name is Enoch. I'm going to take you through enteral feeding. And enteral feeding is a unit in dietherapy, which is very important for every student to learn. I believe that you will listen, and at the end of the lesson, you will be able to apply some concepts and even skills that we are supposed to learn. Okay, so to start with, I want to introduce some key terms that are very essential, very important for every person or every nutritionist to understand, uh, especially in enteral nutrition. One of the terms is enteral nutrition. Enteral nutrition is basically provision of nutrients into the gastrointestinal tract through a tube or even a catheter when oral intake is inadequate. This may include formulas as oral supplement or meal replacements. Uh, Another term is oral nutrition supplements. Uh, these are sterile liquids, semi-solid or in powder form, which provide macro and micronutrients. As you understand, macronutrients are the nutrients which are needed in a very large amount by our bodies, and mostly they are proteins, carbohydrates, and even fats and minerals. Fats alone. Then, when we come to micronutrients, it means that it is required by the body in a very small amount, and that will now we get vitamins and mineral in that category. So another term which is very important for you as a nutritionist is malnutrition. Malnutrition is a key term which is being used everywhere, even in your other subjects, because every nutrition should be aware that there is malnutrition and correct it appropriately. So malnutrition refers to the deficiencies, excess or imbalance in a person's intake of energy. So you can either take less or excess. It causes malnutrition, and that is why you find some people, some of them are underweight and they are malnourished, and even you find others are obese and they also fall under the category of malnourished. So there are some conditions that often require enteral nutrition, and these are some of the conditions. One is when there is an impaired nutrient ingestion. So when there is an impaired nutrient ingestion becomes a problem, and a doctor may prefer or may recommend enteral nutrition. So this impairment can be caused by neurological disorders, facial trauma, oral or esophageal trauma, congenital abnormalities, respiratory failures, cystic fibrosis, and even the GI tract surgeries. Another thing is inability when a patient is unable to consume adequate nutrition orally. So if there is inadequate consumption of adequate food orally, a doctor or a nutritionist will prescribe that patient to be on enteral nutrition. So those conditions that may cause this, one is hypermetabolic states such as trauma and even burns. Another one in that category is cancer. When a patient is having a cancer of the mouth, maybe the brain, and maybe the jaw. So that patient, a doctor or a nutritionist may prefer that. When there is also an impaired digestion, absorption, and metabolism, that is a process of digestion. So when there is atrophy of the process of digestion, so it means that maybe there is a problem with digestion. So of course the supplements that will be given to that patient will be of course pre-digested ones, and that is why it will be administered enterally directly into duodenum or even jejunum. So if there is a problem with absorption, it means that digestion was a problem, and that is why absorption of food becomes also a problem. So, and that is why enteral nutrition should be administered to these patients. Some of the conditions that may cause that is severe gastroparesis, inborn errors of metabolism. There is another disease known as Crohn's disease and as ulcerative colitis. Another one is severe wasting and depressed growth. So there are some people who are severely wasted or depressed growth. We recommend enteral nutrition for such patients. Maybe they may be suffering from those conditions that we mentioned, and some other conditions may include cystic fibrosis, failure to thrive, cancer, sepsis, cerebral palsy, and so forth. So let us now look at enteral nutrition access. How do we introduce this enteral feeding to this patient of ours? There are two types, which is mainly mechanical routes, and we have the surgical routes. So we will have a look at that. For mechanical one, we have what we call nasogastric routes. This one, nasogastric route, is usually the food is introduced through the tube, but the tube starts from the nose, from this word naso, then to gastric, which is the stomach. So and that is why it is called nasogastric route. This one is a type of access which should be done in short term. It's usually 3 to 4 weeks, so it is not long term. So some infusion that can be done is through bolus, intermittent, or even continuous. Another one is nasoduodenal. Naso means the nose, then duodenum means duodenal. So it is naso from the nose through the neck, through the stomach to duodenal. Then for nasojejunal is past duodenal. So this one also is is for short term, 3 to 4 weeks. This usually is preferred when there is a gastric motility disorders, or even esophageal reflux. When a patient experiences some refluxes, we prefer nasoduodenal and nasojejunal. Or sometimes when there is a persistent nausea and vomiting, so the doctor or nutritionist can prescribe nasoduodenal routes. Another access is through what we call percutaneous endoscopic gastrostomy or jejunostomy. As you understand from the word ostomy, ostomy means surgery. Then gastro means the stomach. So what happens is that the opening is done through the skin to the fat tissue, subcutaneous tissue, to the stomach directly. not from the nose, not from the mouth, not from the esophagus. It is directly to the stomach. And also there is jejunostomy, which is through the skin, through the fat layer into the jejunum, which is in the small intestine. So this one, remember I said it is basically surgical. We use surgical technique. So this one is preferred for patients with a long-term enteral nutrition. So let's look at the enteral tube placement. The enteral tube placement, we have the nasogastric, which starts from, according to this diagram, it starts from the nose, it moves down to the stomach. But for nasoduodenal, it goes past the stomach to where? To the duodenum. Then nasojejunal starts from the nose, it goes directly to the stomach, past the duodenal to jejunum. So for gastrostomy, this is the direct opening through the skin in the stomach to where? To subcutaneous fat to the stomach. The same with the jejunostomy. Look at those pictures. Look at that child. That is nasogastric tube. That is how it is being inserted. Don't mind the baby smiling. I believe she is receiving a very important nutrient there. Look at the position on how it is being positioned. Then gastrostomy, that is how the surgery is being done. Then the opening is done to the stomach. That is how it looks like physically. Jejunostomy, that is how it looks like. So the assignment. So I want you to go and research, then you come up with the answers for this question. Explain 5 complications of enteral feeding. So this assignment you will hand over to me next week, part 1. Otherwise, I wish you all the best as you read more from there. So next lesson will be for parenteral nutrition. Thank you so much. We meet that time.